Part A. Extract 1. Questions 1 to 12. You hear a community nurse talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Davis Godman, the community nurse. How are you feeling today?
Oh, hello, nurse. Thanks for coming. To be honest, I feel quite under the weather. It all started a few days back. Initially, it was just a general malaise, a sort of sluggishness.
Can you elaborate on that initial feeling, Mihira? Were there any specific symptoms you noticed?
Let me think. First, I just felt a bit off, like when you're coming down with something. Then, my throat started feeling scratchy, like I'd swallowed sandpaper. And now it's really quite sore. Swallowing feels like I'm trying to gulp down rocks.
I understand. You mentioned this started a few days ago. Can you pinpoint when the throat discomfort became more pronounced?
I think it was maybe 2 days ago. Yeah, around Tuesday morning I woke up and it felt significantly worse. And it's been getting progressively more painful since then.
Have you noticed any other symptoms accompanying the sore throat? Perhaps any fever, chills, or headache?
Yes, definitely a bit feverish. I haven't taken my temperature, but I feel hot and a bit shivery sometimes. And my head has been throbbing, especially behind my eyes. Oh, and I've been feeling really tired, completely lassitudinous, you could say.
Lassitudinous? Yes, that's a good way to describe it. Have you experienced any difficulty breathing or any changes in your voice?
No, breathing is fine, thankfully. But my voice does sound a bit funny, almost hoarse. My husband said I sound like I've been shouting at a cricket match.
Right. Let's talk a bit about your lifestyle, Mihira. Could you tell me about your general health and any pre-existing conditions?
Well, generally I'm quite healthy. I try to eat well, mostly home-cooked food. I don't smoke, and I only have an occasional glass of wine. I do enjoy gardening, though I haven't been able to do much lately because of this. No major illnesses in the past, just the usual colds and flu. Oh, I did have my tonsils when I was a child, if that's relevant.
Yes, that's noted. Have you tried any remedies to alleviate your symptoms so far?
Yes, I've been gargling with warm salt water, which gives a little bit of temporary relief. I've also been sucking on lozenges, the ones with honey and lemon. And I tried some over-the-counter analgesics for the pain, but they didn't seem to make a huge difference.
Okay, Mihira. Based on your symptoms, the acute onset of sore throat, dysphagia, fever, headache, and hoarseness, and considering the inflammation I can observe during my oropharyngeal examination, it's highly suggestive of tonsillitis.
Tonsillitis? Oh dear. What does that mean?
It's an inflammation of your tonsils, Mihira, usually caused by a viral or bacterial infection. We'll need to manage your symptoms and support your body's recovery.
Right, okay. So what do I need to do?
The primary treatment will focus on relieving your discomfort and allowing your body to fight off the infection. We'll start with conservative management. This includes continuing with warm salt water gargles several times a day. Ensure the water is comfortably warm, not too hot.
Okay, continue what I do. Got it.
Yes. You should also maintain adequate hydration by drinking plenty of fluids. Water, herbal teas, or clear broths are good options. Rest is also crucial to allow your body to heal. Avoid strenuous activities.
Lots of rest and fluids. Makes sense.
For pain and fever management, you can take paracetamol as needed, following the dosage instructions on the packet. If your symptoms don't show significant improvement within the next 48 to 72 hours, or if you develop new symptoms such as difficulty breathing, a severe headache, or a rash, it's important that you schedule an appointment with your general practitioner.
So, if it doesn't get better in a couple of days, I should see my doctor?
Exactly, Mihira. They may need to perform further investigations or consider other treatment options if the tonsillitis is bacterial. I'll leave you with this information sheet outlining everything we've discussed. Please don't hesitate to call if you have any concerns before then.
Thank you so much, Nurse Davis.
Extract 2. Questions 13 to 24. You hear a surgeon talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Please have a seat. I understand you've been experiencing some knee issues.
Yes, Dr. Edmount. Thank you. It's been quite bothersome lately. It all started a few months ago. Just a little niggle, around my kneecap, especially after I'd been on my feet for a while. I initially thought it was just muscle strain from all the running around I do at work.
And what line of work are you in, Mihira?
I work at a maison, a fashion house. I'm a seamstress there, so I'm often sitting for long periods, hunched over my work, but then there are times when I need to rush around for fittings and alterations. It's quite a physically demanding job in its own way, even though it might not sound like it.
I see. How has it progressed, Mihira?
Well, it's definitely gotten worse. Now, it's not just after being on my feet. It happens even when I stand up after sitting for a while. It feels almost like my kneecap is catching on something. Sometimes I get a sharp, shooting pain on the inside of my knee, and other times it's more of a dull, persistent ache that radiates down my leg a bit. It's quite debilitating at times.
Right. Have you tried any treatments or remedies for this so far?
I've tried a few things. Initially, I just rested it when it felt sore. Then I started using heat packs, which seemed to provide some temporary relief. My friend, who had a sports injury once, suggested some over-the-counter non-steroidal anti-inflammatory drugs, like ibuprofen. They helped a little with the pain, but it kept coming back. I also tried those stretchy knee supports, but they didn't seem to make much difference in the long run.
Okay. Based on your description of the pain, the catching sensation, the crepitus, and the feeling of instability, along with the physical examination I've just conducted, where I noted some malalignment of the patella and pain on palpation of the medial facet, it strongly suggests a patellar tracking disorder.
What exactly does that involve, doctor?
It means that your kneecap or patella isn't moving smoothly within the groove at the end of your thigh bone, the femur. Instead of gliding straight up and down, it's deviating, often tracking laterally. This can cause pain, the catching sensation you described, and the feeling of instability.
Oh, I see. So, what can be done about it?
Initially, we'll focus on conservative management. This will involve a course of physiotherapy to strengthen the muscles around your knee, particularly the vastus medialis obliquus, which helps to stabilize the patella. These exercises will help improve the tracking of your kneecap.
Physiotherapy, okay. How long will that take?
It varies from person to person, Mihira, but typically a structured physiotherapy program can last for several weeks, perhaps 2 to 3 months, with regular sessions and exercises to do at home. We might also consider a short course of stronger analgesics if the pain is significantly impacting your daily activities, but the focus is on addressing the underlying biomechanical issue.
Are there any risks with the physiotherapy?
The risks associated with physiotherapy are generally low. You might experience some initial discomfort or muscle soreness as you start the exercises, but this usually subsides as your muscles strengthen. It's crucial to follow the physiotherapist's instructions carefully to avoid any strain. In the long term, if conservative treatment doesn't provide sufficient relief, we might consider surgical options to realign the patella, but that's usually reserved for more severe cases.
Surgery sounds a bit scary.
We'll certainly aim to avoid surgery if possible. Let's start with the physiotherapy and see how you respond. I'll provide you with a referral to a physiotherapist for knee rehabilitation. How does that sound?
That sounds like a good plan, doctor.
Mihira, we'll schedule a follow-up appointment in about 6 weeks to assess your progress. I hope you start feeling some improvement soon.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse manager called Mihira, conducting a morning briefing. Now read the question.
Good morning, everyone. Thanks for being prompt. Let's quickly run through today's priorities. David, how's Mr. Henderson doing on ward A? Still reporting intermittent episodes of breathlessness, is he? We need to monitor his oxygen saturation closely, especially after any ambulation. Sarah, how about Mrs. Albright in B ward? Her complaints of nausea seem to have subsided, which is positive, but she mentioned some discomfort in her lower back this morning. Please assess that thoroughly. It could be muscular or something else entirely.
Right, Mihira. Mr. Henderson's sats dipped to 92% after his short walk to the restroom. We've got him back on low-flow oxygen, and he seems more comfortable now. I'll keep a very close eye on him and document any further episodes.
Noted, Mihira. I'll do a full assessment of Mrs. Albright's back pain. She described it as a dull ache, radiating slightly. She's usually quite stoic, so even a mild complaint warrants a thorough check. Oh, and just a quick update on Mr. Finch in C ward. His blood glucose levels have been fluctuating quite a bit overnight. We've adjusted his insulin as per protocol, but we need to monitor him closely for any signs of hypo or hyperglycemia.
Excellent. Vigilance is key with all our patients. Remember, seemingly minor complaints can sometimes indicate underlying issues. Let's ensure we're communicating effectively and documenting everything meticulously. Any questions before we start our rounds?
Now look at question 26. You hear a doctor called Mihira, talking to a junior doctor. Now read the question.
James, come in. Let's quickly discuss a few cases before your ward rounds. First, Mrs. Davies, the elderly patient with the persistent cough. Her latest chest X-ray shows some consolidation in the lower lobe. We initially suspected a simple lower respiratory tract infection, but given her age and the lack of significant improvement with the initial antibiotics, we need to broaden our differential diagnosis. Consider atypical pneumonias and perhaps even a pulmonary embolism.
Right, Dr. Mihira. I was reviewing her chart. She did mention some calf pain yesterday, which I attributed to immobility. Perhaps that's more significant now in light of the X-ray findings.
Precisely. Always consider the constellation of symptoms. Now, moving on to young Mr. Harrison, the athlete with the knee injury. The MRI confirms a significant meniscal tear. He's quite keen to get back to his sport quickly. We need to have a frank discussion about the recovery timeline and the importance of adherence to the physiotherapy protocol to prevent long-term instability. Rushing his rehabilitation could lead to further complications.
Understood. He did seem quite anxious about the recovery duration during my initial assessment. I'll emphasize the potential for re-injury if he doesn't follow the rehab plan diligently.
Good. Finally, a quick word on baby Olivia. Her jaundice levels are still slightly elevated, though trending downwards. We'll continue phototherapy for another 24 hours and monitor her bilirubin closely. The main concern here is preventing any neurological sequelae from hyperbilirubinemia.
Yes, the nursing staff have been diligent with the phototherapy. I'll review her latest bilirubin levels this morning.
Excellent. So the key takeaway here is to always look at the bigger picture, correlate findings, and educate patients about the potential consequences of their conditions and treatment adherence.
Now look at question 27. You hear a school nurse called Mihira talking to a GP. Now read the question.
Good afternoon, Dr. Evans. Thanks for coming by. I wanted to discuss a few students causing some concern. First, young Thomas in Year 3 has been complaining of recurrent abdominal pain. His mother thinks it might be anxiety-related, but he also mentioned feeling quite fatigued. I think we should rule out any underlying organic causes before attributing it solely to stress.
Agreed, Mihira. Recurrent abdominal pain with fatigue in a child warrants investigation. Has he had any changes in bowel habits or loss of appetite? Those would be red flags.
Not that he's reported. Then there's Sarah in Year 6. She's been having frequent headaches, which her parents are managing with over-the-counter analgesics. However, she's also mentioned some blurred vision recently. I'm a bit worried this could be more than just tension headaches.
Blurred vision alongside headaches is definitely concerning in a child. We should probably get her eyes checked and consider other potential causes like migraines or even raised intracranial pressure, though that's less likely.
My thoughts exactly. Finally, I'm a bit unsure about Michael in Year 5. He's been increasingly withdrawn and his teacher has noticed a significant drop in his academic performance. His parents haven't reported any issues at home, but he seems quite isolated at school. I suspect there might be some underlying social or emotional difficulties we need to address.
It's important not to dismiss changes in behavior and academic performance in children. While there might not be an obvious physical cause, these can significantly impact their well-being. Mihira, a collaborative approach with his teacher and parents would be beneficial to understand the situation better.
That's what I was thinking too. A unified approach is crucial in these situations.
Now look at question 28. You hear a dentist called Mihira talking to a general practitioner. Now read the question.
Hi, Dr. Lewis. Thanks for coming over. I wanted to discuss a few patients where their oral health seems linked to other issues. First, Mr. Jones. He's presented with recurring oral thrush despite multiple courses of antifungals. His medical history mentions well-managed type 2 diabetes. However, this persistent infection makes me wonder if his glycemic control has recently deteriorated.
That's a good point, Mihira. Recurrent thrush can indeed be a sign of poor blood sugar management in diabetics. I'll certainly review his latest HbA1c levels and perhaps schedule him for a checkup sooner than planned.
Thanks. Then there's Mrs. Green, who's been complaining of severe tooth sensitivity and erosion, particularly on her upper molars. She mentions suffering from frequent heartburn, which she manages with over-the-counter antacids. I suspect the gastric reflux might be contributing significantly to the enamel wear.
That's a likely correlation. Gastric acid is highly erosive to dental enamel. We should probably discuss lifestyle modifications and perhaps a more effective management plan for her reflux to protect her teeth in the long run.
Agreed. Finally, I'm a bit concerned about young Emily. Her gums are consistently inflamed and bleed easily, despite good oral hygiene practices reported by her mother. Her medical history is unremarkable, but this level of gingivitis in a child makes me wonder if there might be an underlying nutritional deficiency or even a subtle immune issue.
Persistent gingivitis despite good hygiene in a child is unusual. Mihira, it might be worth checking her vitamin levels and perhaps doing a basic blood panel just to rule out anything systemic.
Exactly my thoughts. It's important to consider the broader health context when assessing oral conditions.
Now look at question 29. You hear a nurse called Mihira talking to a colleague. Now read the question.
Ben, have you had a chance to review Mr. Carter's overnight observations? His blood pressure has been quite labile, fluctuating significantly between readings. We need to monitor that closely, especially given his history of hypertension. Ensure we're documenting each measurement accurately and noting any associated symptoms like dizziness or headache.
Yes, Mihira. I noticed that too. His morning reading was slightly elevated again. He did mention feeling a bit lightheaded after breakfast. I made a note of it in his chart. How about Mrs. Davies in the next room? Her oxygen saturation dropped to 91% during her physiotherapy session this morning. We might need to reassess her oxygen delivery method or perhaps consult with a respiratory therapist if it happens again.
Agreed. Let's keep a close eye on Mrs. Davies during any activity. For Mr. Khan, his pain management seems to be suboptimal. He's still reporting breakthrough pain despite his regular opioid dose. We might need to discuss a change in his analgesic regimen with the doctor during rounds, perhaps consider a different medication or an increased frequency.
I agree. He was quite distressed during the night. I administered the PRN dose as prescribed, but it only provided temporary relief. It's impacting his ability to mobilize effectively.
Exactly. So, the key focus for our morning assessment is to identify any trends or persistent issues that require further intervention or escalation. Accurate documentation and clear communication are vital to ensure we're providing the best possible care for our patients.
Now look at question 30. You hear a social worker called Mihira talking to a doctor. Now read the question.
Dr. Ryan, thanks for meeting with me. I wanted to discuss a few patients facing significant psychosocial challenges impacting their recovery. First, Mr. Peterson, the gentleman with the fractured hip. While his surgery was successful, he's expressed significant anxiety about returning home. His wife is frail, and he's worried about managing independently. We might need to explore home health support or even a short-term rehabilitation facility.
That's important to address, Mihira. A supportive home environment is crucial for recovery after a fracture, especially in older adults. Let's look into those options. How about Ms. Rodriguez, the young mother with the new diabetes diagnosis? She's overwhelmed with managing her insulin, attending appointments, and caring for her toddler. She mentioned feeling quite isolated and lacking family support.
Yes, she's facing considerable emotional and practical barriers. I've connected her with a local support group for young parents with chronic conditions, and I'm also exploring options for childcare assistance during her medical appointments. Finally, I'm concerned about young Ben, the teenager with the recent asthma exacerbation. His family is facing significant financial strain, and his mother is worried about affording his ongoing medication. This added stress is likely impacting his overall well-being.
Financial hardship can certainly exacerbate health issues, especially chronic conditions like asthma. Let's connect his family with the hospital's financial aid resources and explore options for prescription assistance programs. Mihira, addressing these social determinants of health is crucial for their long-term management.
Absolutely. Addressing these underlying issues can significantly improve their health outcomes and overall quality of life.
Part C. Extract 1. Questions 31 to 36. You hear the conversation between a social worker, Mihira, and an interviewer. You now have 90 seconds to read questions.
Good afternoon, Mihira. Thank you for taking the time to speak with me today. We're very interested in learning more about your experiences as a social worker, particularly the diverse roles you've undertaken throughout your career. To begin, could you tell us about your initial motivations for entering this demanding yet rewarding field? What sparked your interest in social work?
Thank you for having me. My journey into social work wasn't a sudden decision, but rather a gradual realization fueled by a deep-seated desire to advocate for the vulnerable. Even during my formative years, I was acutely aware of societal disparities and the systemic challenges faced by marginalized communities. I recall a specific instance during my undergraduate studies when I volunteered at a local community center, witnessing firsthand the profound impact that empathetic and informed support could have on individuals navigating incredibly difficult circumstances solidified my resolve. It wasn't just about offering immediate aid. It was about empowering people to navigate complex systems, build resilience, and ultimately advocate for themselves. This experience highlighted the crucial role of social workers as facilitators of change, and that resonated deeply with my personal values. The multifaceted nature of the profession, the opportunity to work with diverse populations, and the potential to contribute to meaningful social change were all significant factors that drew me in.
That's a very insightful beginning. Your early experiences clearly shaped your path. Now, Mihira, you've worked in various settings, including child protection services. That's often perceived as a particularly challenging area. Could you share some of the unique demands and rewards of working in child protection? What were some of the key skills and approaches you found most crucial in that context?
Working in child protection certainly presents a unique set of emotional and ethical complexities. The primary demand, without a doubt, is navigating situations where children are at risk of harm or neglect. This requires a high degree of emotional resilience, the ability to remain objective under pressure, and a meticulous understanding of legal frameworks and safeguarding procedures. One of the most crucial skills I developed was the ability to build rapport and trust with children who may have experienced significant trauma and may be hesitant to communicate openly. This often involved employing child-centered communication techniques, active listening, and creating a safe and non-judgmental space. Collaboration with other professionals, teachers, healthcare providers, and law enforcement was also paramount to ensure a holistic and coordinated response. The rewards, though often less visible, were incredibly profound. Witnessing a child move from a situation of vulnerability to one of safety and stability, and knowing that you played a part in that transformation, was immensely gratifying. Even small victories, like a child starting to trust an adult again or expressing their needs, were deeply meaningful and reinforced the importance of this challenging work.
Your experience highlights the critical need for interprofessional collaboration. Moving on, you also spent a significant period working with individuals experiencing mental health challenges. How did your role differ in that setting compared to child protection and Mihira? What specific strategies did you find effective in supporting their recovery journeys?
The focus in mental health services shifted towards supporting individuals in their recovery and promoting their overall well-being within the community. While safeguarding remained important in certain cases, the emphasis was more on empowerment, promoting autonomy, and facilitating access to appropriate mental health services and resources. My role involved conducting psychosocial assessments, developing individualized support plans, providing therapeutic interventions like motivational interviewing and cognitive behavioral techniques, and advocating for access to housing, employment, and social inclusion opportunities. Building a strong therapeutic alliance based on empathy, genuineness, and unconditional positive regard was paramount. It was crucial to understand the individual's lived experiences, their strengths, and their goals for recovery. Strategies that proved particularly effective included psychoeducation to help individuals understand their conditions, developing coping mechanisms for managing symptoms, and connecting them with peer support networks. The recovery journey is often nonlinear, with periods of progress and setbacks, so patience, persistence, and a belief in the individual's potential for growth were essential.
That's a valuable insight into the nuances of mental health support. You also mentioned working with individuals facing homelessness. This is another area with significant social and economic complexities. Mihira, what were some of the key challenges you encountered in that role, and how did you work to address the multifaceted needs of this population?
Working with individuals experiencing homelessness presented a unique set of interconnected challenges. Lack of stable housing was often intertwined with issues such as poverty, unemployment, mental health difficulties, substance misuse, and a lack of access to basic necessities like healthcare and sanitation. One of the primary challenges was building trust with individuals who may have experienced significant trauma, discrimination, and broken promises. A person-centered and trauma-informed approach was crucial. This involved actively listening to their stories, validating their experiences, and working collaboratively to identify their immediate needs and long-term goals. Addressing the multifaceted needs required a multi-agency approach. This involved networking with shelters, housing providers, healthcare services, employment agencies, and other community resources to connect individuals with the support they needed. Advocacy played a significant role, both at an individual level to navigate complex bureaucratic systems and at a systemic level to address the root causes of homelessness. It was about recognizing the inherent dignity of each individual and working to empower them to regain stability and rebuild their lives.
Your commitment to addressing systemic issues is evident. You also have experience in working with refugee and asylum seeker populations. This often involves navigating cultural differences and complex immigration processes. Mihira, what were some of the key cultural competencies and advocacy skills that were essential in this area of your work?
Working with refugees and asylum seekers required a significant degree of cultural humility and sensitivity. It was crucial to recognize and respect diverse cultural backgrounds, communication styles, and belief systems. This involved actively seeking to understand their experiences, acknowledging the trauma they may have endured, and adapting my communication and interventions accordingly. Employing interpreters effectively and being mindful of potential language barriers was essential. Advocacy played a critical role in this context, both at an individual level to navigate complex immigration laws and asylum processes, and at a systemic level to raise awareness about the challenges faced by this population and advocate for more humane and just policies. This often involved collaborating with immigration lawyers, community organizations, and policymakers. Building trust and rapport was particularly important, given the vulnerability and potential mistrust stemming from their experiences. It was about creating a welcoming and supportive environment where individuals felt safe to share their stories and access the support they needed to rebuild their lives in a new country.
Your breadth of experience is truly remarkable, Mihira. Finally, considering your diverse roles, What overarching principles or values have consistently guided your practice as a social worker, regardless of the specific population you were working with? What are the fundamental tenets that underpin your approach to social work?
Across all my roles, several core principles have consistently guided my practice. Firstly, a deep respect for the inherent dignity and worth of every individual. This means recognizing their strengths, their autonomy, and their right to self-determination, even in the most challenging circumstances. Secondly, a commitment to social justice and equity. This involves recognizing systemic inequalities and advocating for policies and practices that promote fairness and equal opportunities for all. Thirdly, the importance of empathy and compassion. Understanding and validating individuals' experiences and approaching them with genuine care and concern is fundamental to building effective helping relationships. Fourthly, a strengths-based approach, focusing on individuals' capabilities and resources rather than solely on their deficits. This empowers them to be active participants in their own lives and recovery. Finally, a commitment to ethical practice, adhering to professional codes of conduct and ensuring accountability in my work. These principles, I believe, form the bedrock of effective and ethical social work practice, enabling us to truly make a positive difference in the lives of the individuals and communities we serve.
Extract 2. Questions 37 to 42. You hear a presentation by a Dr. Gibson Rosewood on healthcare worker safety at Mihira Healthcare Institute. You now have 90 seconds to read questions.
Good morning, everyone. I'm Dr. Gibson Rosewood, and I'm here today to present our research findings on healthcare worker safety at Mihira Healthcare Institute. This is a topic of paramount importance, not only for the well-being of our dedicated staff, but also for the quality of care we provide to our patients. Our research has delved into various aspects of this issue, uncovering some critical areas that require our attention. Our investigation at Mihira Healthcare Institute revealed several interconnected problems that compromise the safety of our healthcare workers. One significant issue is the prevalence of workplace violence, encompassing both verbal and physical assaults from patients and visitors. This is a distressing reality that many of our staff members face, often going unreported due to a perceived lack of effective response mechanisms. Another key challenge is the high incidence of musculoskeletal injuries, particularly among nursing staff, resulting from patient handling and repetitive tasks. This leads to chronic pain, disability, and increased absenteeism. Additionally, we identified a concerning level of burnout and psychological distress among our staff, driven by factors such as demanding workloads, long hours, and the emotional toll of caring for critically ill patients. This burnout not only affects individual well-being but also impacts staff morale and overall productivity within Mihira Care. The consequences of these unsafe practices are far-reaching and detrimental. For our healthcare workers, They include physical injuries, chronic pain, psychological trauma, increased stress levels, and a higher risk of developing mental health conditions like anxiety and depression. This, in turn, leads to decreased job satisfaction, increased absenteeism, and a higher turnover rate, which ultimately impacts the continuity and quality of care at Mihira Healthcare Institute. Moreover, unsafe practices can compromise patient safety. Burnout and fatigue can impair clinical judgment, increase the likelihood of medical errors, and reduce the overall quality of patient interactions. The financial implications for Mihira Care are also significant, including increased workers' compensation claims, recruitment and training costs, and potential legal liabilities. Our research indicates that the primary causes of these problems are multifaceted and complex. A key factor is inadequate staffing levels, which place excessive demands on individual healthcare workers, leading to fatigue and increased risk of errors and injuries. Another contributing factor is insufficient training in areas such as violence prevention, safe patient handling techniques, and stress management. There's also a pervasive culture of acceptance of workplace violence, where incidents are often underreported or dismissed as part of the job. Furthermore, a lack of clear policies and procedures for reporting and addressing safety concerns creates a climate where workers feel unsupported and reluctant to speak up. The design of our physical work environment also plays a role. For example, inadequate space for patient handling and poorly designed workstations can contribute to musculoskeletal injuries. The organizational culture within Mihira Healthcare Institute, while generally positive, needs to be more proactive in prioritizing and promoting worker safety. To address these challenges, we propose a comprehensive set of measures. Firstly, implementing robust violence prevention programs that include training for staff on de-escalation techniques, risk assessment, and reporting procedures is crucial. We also recommend improving staffing levels to reduce workload and fatigue. Investing in ergonomic equipment and providing training on safe patient handling techniques can significantly reduce the risk of musculoskeletal injuries. Moreover, we need to promote a culture of safety where workers feel empowered to report concerns without fear of reprisal. This involves establishing clear reporting mechanisms, ensuring prompt investigation of incidents, and providing support to affected staff. At Mihira Healthcare Institute, we must foster an environment where safety is not just a priority, but a core value. Effective implementation of these measures requires a multi-pronged approach. We propose establishing a dedicated safety committee at Mihira Healthcare Institute, comprising representatives from various departments, to oversee the development and implementation of safety policies and procedures. Regular safety audits should be conducted to identify potential hazards and assess the effectiveness of existing measures. We also need to invest in technology, such as patient handling aids and wearable devices, to enhance worker safety. Crucially, we need to foster a culture of shared responsibility, where all staff members, from senior management to frontline workers, are actively involved in promoting and maintaining a safe work environment. This involves providing ongoing training, promoting open communication, and recognizing and rewarding safe work practices. Looking ahead, the future of healthcare worker safety at Mihira Healthcare Institute hinges on our collective commitment to continuous improvement. We must move beyond a reactive approach, where we only address problems after they occur, to a proactive one that anticipates and prevents potential hazards. This requires ongoing research, data analysis, and the adoption of best practices from other healthcare organizations. We need to embrace a culture of learning, where we continuously evaluate our safety performance, identify areas for improvement, and implement evidence-based interventions. By prioritizing the safety and well-being of our healthcare workers, we not only fulfill our ethical obligations, but also create a more sustainable and effective healthcare system for the benefit of our patients and our community. The safety of our staff is not just a priority, it is fundamental to the very essence of Mihira Care.